Hello, my name is Dr. Lindsay Dillon. I'm an associate veterinarian here at Veterinary Center of Parker in Parker, Colorado. And in this video, we're going to discuss the diagnosis of cranial cruciate ligament injury in pets. So by definition, cranial cruciate ligament injury is the partial or complete tearing of the cranial cruciate ligament within a pet's knee. The cranial cruciate ligament is basically analogous to ACLs within the human knee. Tearing of the cranial cruciate ligament can lead to knee instability, which ends up leading to changes within the knee, causing osteoarthritis and lameness as well. Cranial cruciate ligament injury is actually the most common orthopedic disease that we see in veterinary medicine. It's very common in dogs and relatively uncommon in cats. It's more common in larger dogs such as Rottweilers, Labrador Retrievers, Newfoundlands, and there's been a genetic predisposition identified in Newfoundlands and Boxers. Risk factors for cranial cruciate ligament injury include dogs being overweight or having systemic diseases such as hyperadrenocorticism, also known as Cushing's disease, which can lead to an overall weakening of ligaments within the body. A good way to assess your animal's body condition score, which we assess every time your dog or cat comes into the clinic, is a good trick is to actually use your hand. And our ideal, how veterinarians would like to see your dog, is with a nice waist, a nice tucked waist, but also being able to feel their ribs, kind of like the top of your knuckles when your hand is flat. If they're overweight, it'll actually feel like the inside of your palm where there's kind of some cushioning on those ribs. And if they're underweight, it'll feel like your knuckles when your hand's in a fist, and that's a little too skinny. So our ideal is right here, and that's one of the best ways to help prevent against cranial cruciate ligament injury in your dog. Dogs will commonly present to the veterinarian as acutely lame or chronically intermittently lame. Those cases of chronically intermittently lame dogs can be caused by partial tears of the cranial cruciate ligament. Each time the dog's noted as being lame, that can actually signify fibers of their cranial cruciate ligament tearing. And each time lameness is noted, that can actually indicate more tearing of those fibers within the cranial cruciate ligament, or starting to involve the medial meniscus or lateral meniscus, most typically the medial meniscus. When dogs present to the veterinarian, their lameness can be anywhere from completely non-weight bearing to toe touching to mildly lame, and that can all depend on the degree of the tear, if there's meniscal involvement, or how chronic the tear has been, and if there's any stability that has started to build up within the joint due to arthritic and bony changes. Next, your veterinarian will begin their physical exam. While they're looking at the dog overall, they may notice that the leg is externally rotated. They may notice that the affected knee is more flexed or bent than the contralateral or opposite knee. They may actually notice that when the dog sits, they splay out that leg, and because the dog doesn't want to bend that knee, because that causes pain, which is why the dog is limping in the first place. As they're palpating all of their legs and their joints, they'll flex and extend their legs and joints, and they actually may notice some stifle or knee thickening, which is caused by a fusion within the joint capsule. Next, your veterinarian will move on to their orthopedic exam. Diagnosis of a cranial cruciate ligament tear is made by a positive cranial drawer test as well as a positive tibial thrust test. A cranial drawer test is when the veterinarian puts one of their hands on the distal aspect of the femur and one of their hands on the proximal aspect of the tibia, and while holding the distal aspect of the femur steady, they can actually translocate the tibia forward or cranially. This movement is actually typically prevented by the cranial cruciate ligament, and by seeing that movement, that means that the cranial cruciate ligament is at least partially or completely ruptured. The tibial thrust test is just a little bit different. The veterinarian puts one of their hands on the bottom or distal part of the femur, and then their index finger over the top of the knee and onto the top of the tibia. With their other hand, they'll grasp the dog's ankle, the bottom of their foot, also known as the hock, and they'll flex the hock. And as they flex the hock, which is similar to the motion that when a dog is standing, the pressure that's put on their knee, the tibia will move forward and actually move the veterinarian's finger forward. Both of those are very indicative of cranial cruciate ligament tear. However, if neither of those are present, that doesn't mean a cranial cruciate ligament tear is not present. Then while your veterinarian is palpating all of your dog's joints, they may actually, when they're flexing and extending the knee, they may feel clicking or crepitus, which can be actually indicative of involvement of the meniscus, also referred to as meniscal clicking. Next, your veterinarian will recommend radiographs to definitively diagnose if there is presence of a cranial cruciate ligament tear. On radiographs, they will take 3 views, one of the affected knee, one of the other knee, just so that they can compare between the 2 knees, and then one of the pelvis and straight on of the knees, and to be able to look at alignments. With radiographs, they can see the effusion within the knee potentially. They can see arthritic changes, which are consistent with cranial cruciate ligament tear. Those arthritic changes can actually start to occur as soon as 3 weeks after an injury occurs. And they can also look for tibial translocation or forward movement, cranial movement of the tibia away from the femur, which, like I said before, is typically prevented by the cranial cruciate ligament. Here at Veterinary Center of Parker, we're lucky enough that we send all of our radiographs off to a board-certified radiologist that all they do is look at radiographs all day long. So we feel pretty confident in our ability to tell if there's a cranial cruciate ligament tear present by us looking at those radiographs, as well as sending them off to a board-certified radiologist. And that will conclude this video. On my next video on cranial cruciate ligament, we'll talk about the cause of cranial cruciate ligament tear, as well as treatment. I hope this information has been beneficial, and I hope you guys check out my next video as well.